To be recorded, please keep your screen off and we'll start the session. So welcome very warmly to Healthwatch Oxfordshire's webinar, where we're very pleased to have Councillor Liz Leffman, Dr Sam Hart and David Munday, representatives of the Oxfordshire Health and Wellbeing Board, to speak to us today about the development of the Health and Wellbeing Strategy for Oxfordshire for 2024 to 30. As I said, we're going to have questions at the end, and there'll be quite a good opportunity to ask questions, and the panel speakers will be able to answer them. I'm acting as chair today. So I'd like to hand over to Councillor Liz Leffman to give the introduction, and she is the chair of the Oxfordshire Health and Wellbeing Board.
Well, thank you very much indeed for Veronica, and thank you for inviting us today, and welcome to everybody that's participating in this webinar on what is a very important topic, which is the health and wellbeing of the residents of Oxfordshire. The Health and Wellbeing Board is a statutory body which I chair as the leader of Oxfordshire County Council. But we do have representatives on this board from all of our city and district councils, and also from our health partners. And we have two sub-boards, if you like, which are the Children's Trust and the Health Improvement Board, which then feed into the Health and Wellbeing Board. And our responsibility really is to look at the progress that we are making universally across the county in terms of improving people's health and wellbeing. The first thing to say about this new strategy is that this is being developed from 2024 to 2030. The last time that we did a refresh on our strategy was 2019, and of course that was before the pandemic. So an awful lot has changed since then. A lot's changed in terms of people's health, a lot has changed in terms of our lifestyles. All sorts of things have changed, and we need to take that into account when we think about how we're going to move forward and how we're going to improve the health and well-being of residents across the whole county. One of the things that is really important to us is that there is a lot of inequality around health, access to health, but also inequality in terms of health outcomes across the county. It's sometimes quite surprising for people to know that although Oxfordshire is generally seen as a very well-off green county, actually there are real pockets of deprivation, and we have 10 of the most deprived wards in the county, in the country, I should say, actually in this county. So our focus is in looking at how we can improve things for all residents across the county, and that's what we want to bring to this strategy. The important thing to say is there are a number of building blocks that we have to think about, and they're not just associated with the actual health service. There are things like the importance of really good quality housing, the importance of social connections, and the importance of place and neighbourhoods in the way in which we address this. All these things really are quite new, actually, post-pandemic, and they're things that we really need to think about. So a lot of people are spending more time at home. A lot of people have health issues that have come up because of COVID. So all of this is part of the mix. And we want to consider all of that in this webinar, but also throughout the whole of the consultation that we're doing on this strategy. And as Veronica said, the consultation will be open until the 12th of December, and we really look forward to to your contributions. So we'd like to hear from you. That's really important. And I'm now going to hand over to David Munday, who's going to say a little bit about how we're approaching the whole question of refreshing our strategy.
Great. Thank you, Councillor Leffman. Again, let me kind of reiterate that thanks to Healthwatch for inviting us to speak on this topic, and thank you everyone for finding the time to join the webinar. So I'm just going to share my screen and talk through some slides which hopefully help unpack what's happening with the strategy and its development. So I think that is. Can someone confirm if that's shared the slides? Okay, it has. I can see Veronica nodding. Thank you. There's two bits to what I want to say just for a few minutes, if that's okay. The first is a bit on the process of how we've gone about developing the kind of refresh of the draft strategy, which is what is currently out to public consultation. And then the second part is what the headlines and the key priorities are within that, that strategy. I know that some people on the call would have looked at the consultation page, will have looked at the draft strategy already. Others won't yet have had the opportunity to do that, so I'll give some of the headlines to it as well, before then handing over to Dr Sam Hart. So let me just move on to the next screen. So in terms of how we've gone about forming this strategy, there's two kind of pillars really. One is what the data and the insight that we have about Oxfordshire and the health and wellbeing needs tell us, and the second is what residents themselves are telling us in terms of priorities in the health and wellbeing space. To show you therefore just a couple of things, firstly on the data side of things, this is taken, these two maps are taken from our joint strategic needs assessment. So it's always a bit of a mouthful to say, which is our kind of annual review of what's happening with health and wellbeing need in Oxfordshire, and we undertake that each year. We publish that on the County Council website as part of, on behalf of the Health and Wellbeing Board. And what we and the data that was within that is very detailed and varied, and therefore we've been drawing in data into the strategy development that tells us about employment, that tells us about access to green space, that tells us about population growth and change, tells us what's happening with people living in poverty, particularly at the beginning and end of life, looking at what's happening with life expectancy, and so on. So we've taken quite a broad range of data to help inform what the assessment is of need in Oxfordshire for health and wellbeing. And then on the right-hand side, just as Councillor Leffman was describing, that just really shows us where some of those pockets of greater, what we call socioeconomic deprivation. So where essentially we see our communities which have greater challenge and are within the within that that kind of 20% most deprived nationally. The other thing just to say on data then, and then again, this is taken from the Joint Strategic Needs Assessment. It was probably too detailed to see well on your screen, but this is just taking through some key stats and facts and data insight from across the life course of residents in Oxfordshire. And that life course approach is really important, and I'll come back to that when I explain about the way that we're putting together the priorities and the structure of the strategy. So the second part, then the second plank, if you like, of how we've been developing the strategy has been based around what residents have been telling us. So we've spent a lot of time over the summer, and a real thanks to Veronica and the team at Healthwatch, who've helped significantly with this, talking to residents about what their health and wellbeing needs are, what helps improve health and well-being for them, what hinders it, what their priorities are when it comes to health and well-being. And we've had over 1,000 individual conversations and surveying to get insight into that. We've also run a significant number of focus groups, particularly trying to make sure we pick up the views and input from residents who could otherwise be kind of not heard from. And then, of course, that work that's informed the strategy does also is enhanced by then the current public consultation we're doing on the draft strategy. And just to show you some of the output from that, so I mentioned those 3 questions, and what we've seen residents tell us is that, and I'm not going to read everything off the screen, but we know the cost of living is a challenge, and we've heard that very clearly. We also know that access to healthy diet and healthy food that can link to kind of cost of living and inflation challenges is important to people. We know that in terms of how people stay healthy, so that box on the left-hand side, we've seen the importance of being out and about, being physically active, and also in connecting in green space. And just as Councillor Leffman was saying, the importance of family and community connectiveness. And then we can also see on the right-hand side what people are telling us in terms of what's most important for their health and well-being. So those, if you like, are the two kind of arms, both the data and the and kind of resident comment and insight that have helped shape the strategy that we have put together. And this is just a process, just to explain really that we've kind of gone through that publication of the strategy, all of the organisations that are represented on the Health and Wellbeing Board, so everyone who's got a role and responsibility within the health and wellbeing in Oxfordshire have all then been able to input with their own views and priorities and so forth to create a long list which we've refined using that data and insight from residents that I've just described. And then we've had a group that of council, Healthwatch, NHS staff who have been working together to then actually draft up the strategy itself. So that's been the kind of the process to where we are. So in terms of then the strategy itself, what does it look and what does it feel like, particularly for those of you that haven't yet had the chance to look at it in the draft form through the consultation portal? There's 5 bits that I would just want to draw out about the strategy. So we've described it as Oxfordshire's kind of one place strategy on this slide. What I mean by that is every organisation that forms the Health and Wellbeing Board and is a member of that, who has a responsibility for health and wellbeing here, are all agreed that this is the primary partnership strategy that they will work jointly on to seek to be improving health and wellbeing locally. We then form part in Oxfordshire of a wider integrated care system. That's what the ICS stands for, which is greater collaboration between those different players, but at a level that's more akin to the Thames Valley footprint. And there is a overarching strategy that the integrated care system has. So this Oxfordshire County strategy aligns with that wider footprint strategy that is already in place. At its heart, the strategy that we have, this new health and wellbeing strategy, takes that broad view of wellbeing, and I'll show you how we've been framing that in just a moment. Therefore, it doesn't look specifically at issues to do with provision of health services in particular kind of specialist areas or in access to primary care, so much as thinking, what is it that helps you and I be healthy in day-to-day life, and what can we be doing to enhance that? At its heart, what's within the strategy are areas of work that need collaboration between different parts of the organisations that are on the Health and Wellbeing Board. So what we're including in it is areas where we need to be working together more than areas where it's more simply within the gift of one organisation to move forward with. And probably the thing that I hear more than anything else when having conversations with people about the strategy is the importance of the strategy moving on to delivery and making an actual tangible difference. And where we are currently with the work is trying to form that strategy and agree what those kind of priorities and principles should be. Once we've done that, and the idea is to have that kind of final version of the strategy that's agreed in December, we then will develop and publish a delivery plan, i.e. the action plan of how we're going to move forward with the strategy, and also how we're going to monitor to ensure we know that we're making the right progress, and where we aren't, how we can then adapt to do that. So the strategy itself then is based around this wheel. So just to say that at the heart of the wheel, there's 3 kind of fundamental principles that cut through all of the strategy. So we've got the having a focus on preventing ill health rather than having to cure disease. Secondly, this thing about wanting to tackle health inequalities that you've already heard Councillor Leffman refer to. And then thirdly, that we need to be working more closely together as different partners and organisations within the health and wellbeing space, and need that closer collaboration. And then we've taken this life course approach to how we want to be structuring our priorities. So going from start well to living well to age well. And that life course approach is all about acknowledging that as we go through life, there are a range of factors, there are a range of events, there are a range of circumstances that will act to improve and help our health and well-being. And there's also a range of factors, there's a range of circumstances, there's a range of issues that can detract from and cause challenge to our health and well-being. And taking that life course approach is about how we amplify the former and how we deal with and minimize the negative impact of the latter. It's not so much about saying one issue is just for children and one issue is just for older people. It's about trying to take that holistic understanding. And then those building blocks of health that Councillor Leffman referenced are in the turquoise around the outside, and I'll explain just about those. And then finally, things that we think will help us deliver the strategy, which we've called enablers. So let me just show you some of that quickly, and then I'll pass on to Dr. Hart. So just to say then, within the strategy, what you'll see is, so this is just to show you the priority within Live Well. You've got, if I just actually go back a slide, you've got an overall ambition statement within this particular priority of Live Well, which is about healthy people and healthy places. You've got quotes that have come from that resident insight that I have referenced earlier, got a case study of what already is happening and working well in that space. You've then got ambitions about what we want to see if we've achieved by 2030, as well as then listing some of those immediate actions that we think we can take. But as I've described, those fuller action planning will happen subsequently to the strategy itself. So that's just to give you a feel for what the pages look like. So within Start Well, we've defined two key priorities. So the best start in life being critical for health and wellbeing in Oxfordshire, because we know that so much of good health is formed in the early years and then carries through across someone's life. So if you look at something like unhealthy weight, you see it's becomes a bit of an issue for 4-year-olds. It's a bigger issue when you get to 11-year-olds, and it becomes then bigger still when you kind of look at adults. So there's something about getting it right at the start. If you think about mental well-being, we know that the vast majority of mental ill health conditions start in childhood. So we therefore need to get the best start in life. We need to do that well, and we know that currently the data tells us that there are some circumstances of some communities, their children living there are less likely to get that best start in life. Secondly, then, we've seen an increasing challenge in terms of children and young people's mental well-being, and some of that is the shadow of COVID and the impact that that's had in terms of disrupted education, but it's not simply that. And we are therefore having that as a second kind of priority within the Start Well space. To then touch on Live Well, we are wanting to have a focus on ensuring that we have healthy people and healthy places. So there's issues such as tobacco, unhealthy food and alcohol, which can all detract from people's well-being. And what the strategy is wanting to build is that work on how we can ensure that the places that we live and work in, where we go to school, where we have recreation and so forth, are as healthy as possible, so that they're smoke-free, that unhealthy food isn't being, we're controlling how that is being advertised and promoted, and we're making healthy options available to people. And then the second priority within Live Well is all about how we maintain physical activity, and active travel is a part of that. And we heard very clearly from talking to residents about how important physical activity is to them. And we know it's something that improves both physical and mental well-being significantly, and is therefore a really important part of well-being. And then finally, within the life course part, the Age Well priorities are around maintaining independence, which is particularly important as people get older, and then also about ensuring that there's strong social relationships. And as I say, these are not so much about saying some issues are just in children, some are just in the middle of life, and some are just in older life. This is about taking that kind of holistic across the life view. And then to just touch on the building blocks of health, and you won't be able to read it, but you can just see the wheels still in the top corner. So these are this turquoise part on the wheel. We've wanting to have action on 4 areas that we think are fundamental to improving health and well-being locally. So it's about having good work which improves health, and that about having financial stability. It's about climate change and health and the challenges that that can pose, and also the opportunities for things that can improve the issues around climate change can also be good for health and well-being. Thirdly, then, the importance of homes and homes that promote and support health and don't detract from it. And then fourthly, us all living and working in vibrant communities that are that have good social connections and that are supportive of good health. And then I think the final thing for me to say is then we've then got those three enablers of health, enablers of the strategy, that will help us move forward with action. And that's about having the right workforce. It's about having the right data and insight. And then also this concept of anchor institutions, just to explain what I mean by that idea that there are a number of organisations in Oxfordshire, both, and this does not necessarily mean public sector organisations, although it would include those, but also includes a range of business partners, as well as some voluntary and community sector organisations that are here for the long term and have a significant stake in the local community. And how do we work with those organisations to ensure that they are supporting and helping health and well-being? So I think, therefore, as I've been touching on as I've gone through, this final slide is really just to say that once we publish the strategy in its final form in December, we will then look to move into ensuring that we are both have the action plan for delivery, and also we're monitoring the progress against this strategy itself. And then the link to the consultation is here, and I'm sure that's available through the Healthwatch page that you've seen this webinar advertised on, and that's still open till Sunday for people to make responses to. So I'm going to stop sharing my screen.
Can I just remind you of the time? We're at 22 now. So if Sam could talk briefly, that would be great. And then we need to hand over so people have a chance to ask questions. Thank you, David. That's wonderful.
Not a problem to be brief either. Thanks, everyone, for the introductions to date. I won't go back over those, but just to clarify my position, I'm Dr Sam Hart. I'm a GP who works in isolate medical practice just outside of Oxford City. I also work for the local Integrated Care Board, or ICB, and one of my roles within that position is the Vice Chair of the Health and Wellbeing Board. So I have been part of developing this strategy with the wider Health and Wellbeing Board. I wanted to say within this sort of concluding part or statement that I've worked as a GP in the local area for nearly a decade, and throughout that time consulted with thousands of patients. And my experience has shown me that so much of ill health originates in the issues that this strategy is trying to address. And often these issues are well beyond what a GP consultation can remedy, even beyond what a coordinated whole practice or NHS response over many professionals and much time is able to achieve as well. And that's why we must start further upstream and explicitly aim to prevent ill health, and why we must work together better with all of our system partners. And this is going to require effort, open-mindedness, and a will to collaborate. But we're up for the challenge, and it's why these things are cited explicitly in our health and wellbeing strategy, with collaboration as a central priority in that wheel that David demonstrated, and recognition of certain enablers to achieve this. In looking further upstream, we recognise the key importance of influencing those building blocks of health that have been touched on by both Councillor Leffman and David just now. And these are, of course, building blocks of health, both in the physical and mental health sense. And perhaps most importantly, these came out really clearly during the engagement phase with our residents. And I believe I saw a comment in the chat, or a question in the chat, about listening and consulting and acting on that. Well, I think what I'm hopeful is that in the priority list that we identified in discussions with residents, it was clear that those are reflected in this draft strategy as it stands. I think it's also just important to finally emphasise that it is a joint strategy, and that means it's work between council, NHS, and a range of community partners. And that's why we've identified these enablers to promote closer collaboration. And has also been said that it runs to 2030, and that's a long time, and inevitably new challenges will arise. during that time frame, which, where appropriate, will be adopted into our local health and wellbeing strategy for Oxfordshire. So with you having heard about the strategy and having heard a bit more about those really fundamental building blocks of health, hopefully that puts you in the picture a little bit better. I think this is where we hand over for questions.
Thank you all. That's been a really comprehensive view of the emerging strategy. I'm going to pick out a question from the chat. If you could just make sure people are muted. The first question was from Anthony Buchanan. Does the strategy include improving health outcomes for the homeless community? He says there's lots of research around homeless people not trusting primary healthcare services. And as Oxford has one of the highest death rates, what's your strategy for tackling the inequalities they experience? So I think, who would that be? Good.
I'm happy to make comment to that, Veronica. Thank you. A really important question. What we have included so far within the strategy is that within the so I showed that one of those kind of building blocks to health was about housing and was about healthy homes. And as we've started to then develop that more and start thinking about, okay, what will be in that delivery plan around healthy homes, there's already a kind of an action line around homelessness and health, and I think there's probably two parts to that. There's one, how do we ensure that the health of people experiencing homelessness and rough sleeping is supported as far as possible, and I think that goes particularly to the point that to the question that Anthony's raised. I think the other part to it is then what work can be done to be preventing people moving into falling into rough sleeping and homelessness, thinking about the population who are kind of vulnerably housed or in temporary accommodation as well. So I think there'll be kind of two strands to that. That will, I think it's probably fair to say, be fleshed out a bit more clearly in the delivery plan element of the work, as opposed to fully within the draft that people can kind of see at this stage.
Okay. Thank you very much. Now we've got a question from Becky Walker. Becky, would you like to ask your question, please?
Yeah, hi, I'm Becky Walker from Oxford City Council. I'm just picking up on the point one of the slides there you were showing, that it says everybody should have access to affordable and energy efficiency homes. But it then says that social, private, rented and new build homes should be of a good material standard and maintained to prevent health issues, especially from cold and overheating. And because it's something that at Oxford City Council, we work with a lot of older and disabled people. And the Centre for Ageing Better have said that 79% of older people actually live in their own homes, so they're not private rented and they're not housing associations. They tend to live in their own homes. So I think it's really important to reflect the fact that a lot of people live in their own homes, and health does really affect their health. So it's something that we need to give them support with, which we do at Oxford City Council, but I think the strategy should also reflect that.
And yeah, maybe if I can just chip in on that, Becky, thank you. And yeah, I very much agree. And I think that just as you've identified within the City Council, I think all of our district councils around the county have got a really important role to play in this area particularly. I think there may just be a nuancing of wording we haven't necessarily quite got right there, because absolutely we would agree that what we need to be supporting is people's homes to be enabling health, whatever type of tenure and whatever type of ownership and so forth that they have. One of the things that we have already in place in Oxfordshire, which has been building over the last couple of years, as a better housing, better health kind of service, which would do exactly that. It would cover kind of those health related aspects of housing whatever people's kind of ownership. So I think that's helpful to ensure that what we're saying within the strategy reflects that. I think that there are some health issues which are then more acutely felt by people who are in the private rented or social rented kind of market, and there's an element that we need to pick up specifically. But I think your point is really well made.
And if I can just add to that, Becky, thank you very much for making that point. I think it's really important that we do have our district and city partners on the Health and Wellbeing Board precisely for this point, because, you know, the conditions in which people live obviously have a profound effect on their health and well-being. So it is a very important part of what we should be looking at over the next few years.
Thank you. Nicola Tomlin has put a question in the chat, but also has her hand up. Nicola, would you like to ask it in person, or would you like me to ask it?
Yes, I can ask it, please.
I'm very sorry, we can't hear you very well. If possible, your sound is very jumpy. So if you didn't mind, I'll ask the question, and you can comment if you can sort your sound out. So Nicola asked, you see, is there anything planned to support families of alcoholics and other addicts as a volunteer at Al-Anon? That's the question there.
Well, maybe I can answer that from the point of view of us as a county council, because we do quite a lot of work with a lot of our work is family oriented. So yes, the answer is that we will be absolutely focusing on supporting the families of people who have addictions, whether it's drugs or alcohol. It's a very important part of what we do. But yes, I agree, it needs to be emphasised, I think, in the strategy.
Thank you. Then we have a question from Sylvia Buckingham. Sylvia, would you like to ask your question?
Thank you, Chair. Well, this week I heard that some patients are asking not to be referred to hospital, and some people are also declining appointments because they cannot physically get there and they cannot afford taxis. And the transport system in Oxfordshire is appalling, as we know. People either can't afford a taxi or they can't get on a bus straight to hospital. So it was suggested that maybe there should be a shuttle bus from a car park that takes patients backwards and forwards. So if they drive, they could park there. But obviously, if they need a taxi, as I said, people are declining to go to hospital because they can't afford it. So this is an inequality that I don't think is really considered because it's hidden.
Thank you, Sylvia. That's a really good point. And it's something that we're very conscious of as a county council responsible for transport. And it's something that we have been talking to the hospitals about doing. And it's something that we need to pursue much more vigorously, because you're right, you know, it's very difficult if you live outside Oxford, actually, even if you live in Oxford sometimes, to access the acute hospitals. So thank you very much for raising that point.
I'd like to bring in an email question we've had, and also I've noticed there's a question in the chat, which is about, does the strategy include anything to do with SEND? And it says, surely fixing SEN around young children will minimise adult social care, reducing costs significantly by giving them an education to lead to a career. Thank you. Perhaps, Liz, would you be?
Yeah, I'll happily respond to that. Thank you very much. Yes, as you know, we've had an Ofsted report recently, and I think some of you on this call will have been at the Health and Wellbeing Board meeting when this was raised. This was discussed. The SEND report was discussed. It's clearly extremely important that we work to get this right, and working with our health partners as well as education partners is very much a part of what we're doing right now. There is a priority action plan which has been submitted to the Department for Education, and we're waiting for their response back on that. The responsibility for improving what we're doing with SEND lies with the SEND Improvement Board, which has recently been established. But it is obviously something that needs to be included in this strategy, because clearly there is a need for us to work together to make sure that we deliver on that service, on that specific area of service as a partnership. But I would suggest that actually the right place for it being scrutinised is not necessarily the Health and Wellbeing Board. It needs to be included in this strategy, but then we need to look at how we can actually scrutinise it through the Children's Trust, for example. So yes, I do agree that we need to reference this in the strategy. I absolutely agree with that. And then we need to look at how we deliver it in partnership with the Children's Trust. But you're absolutely right to make the point about the importance of the connection between what we're doing with our young people and children, and that and how that affects them in their adulthood. And that sort of crossover between children's and adults is really, really important as well, and something that we need to make sure we include in this strategy.
Thank you. We've had a question also in the chat from Sarah Wild, and I think it links into how this whole thing is going to get monitored and how will you actually know you've made a difference. Her question is, why are there no targets in the strategy? Having identified an issue, there needs to be a mechanism to resolve the problem. What's the point of a strategy with no achievable targets?
Yeah, thank you. And I'm happy to pick that one up. And I would agree with that point, that the whole purpose of the strategy is that we move into action, we move into things that deliver a difference to residents, and that we need to be able to monitor that. So I completely agree with the sentiment and where this question is coming from. And I think where we are right now, it's really just a question of timing and the phase of the work. And what the Health and Wellbeing Board has agreed to do is to define the strategy, and it is at quite a high level, and therefore there isn't all of the detail within it, and there are not metrics and targets for monitoring performance and achievement within it. What we wanted to do was define and agree what the priorities for Oxfordshire should be, and then we move on to say, okay, with that, how do we get to where we need to be? What are those key actions, and how do we monitor to know that we've achieved that? So that's the next phase of the work, which happens kind of from December, once we've defined the strategy itself. And the plan for that is that by the Health and Wellbeing Board meeting in March of next year, we would have that action plan and that monitoring plan that would have been worked up. We're keen that in the process of doing that, we get comment and input from residents, from kind of wider partners, not just those who are on the Health and Wellbeing Board itself. So there'll be further opportunity to be able to provide kind of input and comment on that. But I think the mechanism, the process for that, we're still working on. So kind of watch this space on how that will work best.
Thank you very much. We have a question from Alison Champkin Woods. Would you like to ask your question? You're on mute. You need to unmute yourself. Could you unmute?
Sorry. Yeah. Yes, I've unmuted. I'm part of the Ageing Well subgroup for Bob VCSE, and I've attended a webinar also this morning. And I notice around Ageing Well, you mentioned loneliness. And loneliness is clearly an issue for the older people within Oxfordshire. And there are some parts of Oxfordshire that are rural. And I know that on speaking with OCVA, that we are all experiencing problems in acquiring blue badges for those that have disabilities, mobility issues, but also on discussion with Age UK, they've also had problems with acquiring blue badges for those individuals that are suffering with, or having, I should say, dementia. So I think we are running the risk of actually making people more isolated by the fact that organisations and individuals are really struggling to get blue badges to ensure that they can actually get around.
Can I answer that? Because I actually had a conversation about blue badges with somebody in the county council yesterday.
Okay.
I've had a couple of people saying to me recently that they've really struggled to get blue badges. I'll very quickly say that we are looking at ways in which we can improve access for people, because we know that the current access is really a little hard to navigate. So we are very conscious that we need to do better. But I'd also say that in terms of what people are allowed to have, of people who are allowed to have blue badges, that's dictated by the Department for Transport and not by the County Council.
Yeah.
So if people are having trouble actually getting the documentation together that allows them blue badges, do ring our call centre about it, because they are now definitely looking into how they can support people who've had difficulty with finding the documentation and being able to get it to us.
Thank you. I'm going to move back to a question that we've had via email from a member of the public, and I think Sam might be the person to answer this one. Apologies for not attending. I have an excellent GP practice at Marcham Road Health Centre who has one specialist nurse practitioner. Would it be possible to expand this role within the surgeries to relieve some of the pressures on GPs?
Yeah, that makes sense for me to take that one, Veronica. Thank you. Just to check that the person who asked that question hasn't been able to attend. Is that right? The reason I ask that is that the term specialist nurse practitioner could pertain to a number of different potential roles and or levels of qualification. But I think it's a very sensible question, and it really reflects the place we're at within general practice at the minute, trying to address some of the very pressing workforce issues we have in meeting the needs and demands of patients, and finding ways to do this with a very gradually diminishing pool of general practitioners or GPs. So I fully agree with the sentiment, and I suspect that what has happened at the practice that this person is registered at is that this practice has made use of a new funding stream, or I say new, that has been around since about 2019, 2020 to support workforce development in general practice and in primary care. And the aim, there's been a recognition that the GP workforce needs boosting, and with additional healthcare professionals, often termed the additional roles scheme. So I suspect that they have employed an advanced nurse practitioner who has a range of skills at consulting with patients as what we would call a first contact practitioner, so someone who might be the first point of contact to the GP surgery. Often they would usually have skills of assessment and treatment, and often also prescribing. So in many ways they will work like a GP, but they will have a very sort of defined remit to their work, their scope of work, and the practice will carefully triage and ensure and select out patients that would be appropriate for that advanced nurse practitioner or specialist nurse practitioner, to make sure that they see and treat patients with appropriate conditions and can give, excellent intervention and advice. In many ways, like a GP would. It's just that they're not a GP, and I think that sort of also leads to another component of this scheme, this additional role scheme. It's been quite challenging from the perspective of being a GP practice, offering patients a range of appointments with a range of fellow professionals who are very well suited to dealing with the problem at hand, but sometimes there being uncertainty about, from the patient perspective, and understandably so, about whether they're being treated by the right professional. What I'd implore is that, retain an open mind if you're offered an appointment with someone who isn't a GP, but who has been selected to see you or speak to you, because it's almost certain that appointment would have been allocated appropriately, to make sure that, the workforce that we have available is deployed in the most effective way possible for problems that come to patients. And yes, it is something that is definitely an expanding entity.
Thank you. I'm looking at questions in the chat. We've got a number more questions about the links between the strategy and the support to children and young people with SEND, and also sort of questions asking about how there's going to be a connection between like SEND and mental health across the strategy. And then there's other comments about, for example, domestic abuse and the recognition of that and the way it weaves through the strategy. So I think those are sort of general comments. Would anyone like to add to those particular comments there? Verbally, or shall I pick out another question?
I'm happy to just take up this. I know SEND is something that a number of people on this call are concerned about.
You can see that in the chat.
Yes, I'm just looking at Claire's question in the chat about the importance of listening to children and young people with SEND, and yes, that's very much part of the priority plan that's gone to the DFE. So yes, that will be, we will be including that in what we're doing. And that will come back, I think, but that will come back to this, you know, we come back to the strategy, and it has to be included because, of course, you know, there is a link, as you rightly say, between mental health, general mental health, and the health and the needs of children and young people with SEND. So I think we do need to, as I said before, to include a link in our strategy between all those issues, and make sure that we are clear that, you know, we are supporting young people and children with SEND, and indeed adults with disabilities as well.
Veronica, if it's okay, if I could just make a quick comment about domestic abuse. I think I'm really glad to see there's comments about that within the chat. So we have got within Oxfordshire overarching domestic abuse strategy, and that's been very much put together as a partnership kind of piece of work, and that really does try to weave across the issues to do with domestic abuse in different stages of life, in different communities, and so forth. So we do reference domestic abuse within this new health and wellbeing strategy, but we it is not referenced to a high level in terms of kind of frequency or the degree to which it's been referenced. I think because we've got that quite recent Oxfordshire-wide strategy already. So it's, again, maybe a little bit like the comment that Councillor Leffman just made regarding SEND. I think this is about us kind of acknowledging it and also kind of pointing to where more specific kind of work and kind of planning is already in play within the kind of Oxfordshire system.
Thank you. We've got one question that sort of relates to institutions as anchor institutions, and it's about supporting staff who are themselves health promoters in their ability to keep healthy and well, physical activity and managing stress. So maybe someone would like to comment on that.
So happy to kind of make the comment on the anchor institution kind of part, absolutely. And Sam, if there's anything from your point of view in terms of what's happening with kind of NHS workforce and any kind of challenges currently kind of being experienced and how they're supported, I'm sure you'd be able to chip in. So yeah, at the heart, that anchor institution piece, kind of one of the parts of being an anchor institution and an employer being one that supports health and wellbeing is about the workforce. So that is kind of an important element, and we therefore have that kind of anchor institution approach as one of our enablers of the strategy. I think what we have already in Oxfordshire is some really good examples of where different employers, be them kind of health, social care, or others, are supporting health and well-being of their staff. And I think part of what we can do within this strategy and then within the action planning is to see those good examples and to look to use the kind of momentum and the buy-in of this strategy to kind of roll those out further. We are, and we've already been doing some work in Oxfordshire on something called the Make Every Contact Count initiative, which is about how simple conversations between staff members, between people that are kind of interacting with services and so on, can support health and well-being with some of those like basic things that we can all be doing to improve health and well-being. So that's maybe an example of an area where I think there's already good practice and we can be looking to do kind of more on.
Thank you. We've got one more question from the audience. Elizabeth Poskett, would you like to ask your question?
Yes, thank you. In a way, it sort of slightly follows on from what's just been said, and maybe it really has been covered, because I'm afraid I missed the beginning of this. What about, I mean, you talk about caring for the staff who look after people in health and that kind of thing, but what about the carers back home and that sort of thing? When you get to my age, a lot of people are carers, but also another critical area is the child who goes out to school in the morning having maybe got a mum out of bed or that kind of thing. And childcare, or at least child carers, often get neglected. Do you think this is something that should be covered in this? Thank you.
Well, perhaps I can answer that, because I think that's a really good point. As a county council, we have actually got a strategy for looking after carers, whether they're young carers or whether they're older carers. But you're right, it probably needs to be, there needs to be a line drawn between that and what we have in this strategy, I think, because we need, it's also important, I think, and perhaps Sam would like to comment on this, that when somebody is being looked after by someone at home, it's important for the GP to know that as well. So yeah, we do need to consider that in the round.
Just to add that to that, Liz, I'm aware that there is a revised carers strategy in development at present, and there's been emphasis on recognition of carers and how that's translated into the primary care records, so the GP practice records of that person and the person that they look after. And you know, some of the challenges can be that those two people aren't always registered at the same practice. So there's been some careful thought gone into that. I don't know the detail of it, but I'm aware that that is in process. And I think Councillor Leffman's correct to identify that perhaps we, you know, certainly as we look to add deliverables in the coming quarter, is how we more closely link the overarching health and wellbeing strategy that we're discussing today with those sub-strategies that are clearly essential in creating the delivery to some of these important points.
Thank you.
Thank you. We're coming near the end. I'm just going to ask one more question that's in the chat, which is from Rhiannon Asylum Welcome, raising the situation of asylum seekers and refugees who are increasingly, you know, being present in Oxfordshire through Home Office moving people. This group also includes victims of torture and trafficking. It's vital they access healthcare. Supporting this group with accessing and understanding healthcare is key. So how can that be factored into this strategy as well?
I'm happy to make a brief comment on that. Colleagues on the panel may want to add. I think probably there's two parts of this in my thinking. So one of the things that we have got as a building block of health within the strategy is about vibrant communities. And I think then broadly what we need to be seeing in terms of people who are seeking asylum and who are in Oxfordshire, we need to be using this strategy as a way of ensuring there's that integration and there's that connection within the community in the places where they've been dispersed to. And I think that we can't we mustn't kind of underestimate how important that is for those people and kind of broadly for their health and well-being. There's then the more specific point about, well, how do they understand the system, so to speak, in terms of accessing healthcare, and what specialist services are available should they require them, you know, and a couple of examples have been given there in the question. And I think there's I think that probably falls a little bit more within, and I think it was mentioned within the chat about the primary care kind of webinar that's happening on the 1st of December and the plans around kind of primary care strategy locally, because there's a few groups, and we'll definitely include asylum seekers, where we know there are some barriers to how they access specific services, and I think that's the place where that particular point would be going to be able to be moved forward most effectively. And I think within this strategy, that this health and wellbeing strategy, it's about how do we ensure that community connection for people that are dispersed around the county.
Thank you very much. I think we've got just a couple of minutes to wrap up. David, would you just like to say what the next steps are very briefly?
Yeah, absolutely. So the strategy is open for further responses until the end of Sunday, so to the 12th of November. From there, we will be reviewing all of the responses. Some of that will be kind of yes, no, strongly agree, strongly disagree type comments. Some of it will be free text comments, and people are welcome to fill that in. So we'll do that analysis just to understand the overall body of response. I think we've had over 400 responses already to the consultation, which has been great. We've had a number of comments through this meeting and through other meetings that have run in the last few weeks. We will take then a report to the Health and Wellbeing Board on the 7th of December, which is the engagement report that summarises all of that feedback and also points to how we have edited and changed the strategy as a result of it. As I then said earlier, in the first part of next year and by March, we will have a more granular action plan and that monitoring plan of how we move from strategy to action.
Thank you very much. I think I'll draw this to a close. So thank you so much to Liz, David and Sam for that input. It's really great to see the Health and Wellbeing Board engaging, and it might be something that we could do in the future is continue these conversations with people in Oxfordshire as an ongoing. Just to note that Healthwatch Oxfordshire will be running another webinar on the 1st of December, slightly confusingly, yet another strategy from the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board. It's an opportunity to hear from the place director, Dan Levison, about the new emerging primary care strategy that's going to be part of the IC Integrated Care Board's work. So please do come to that and give your comments. And that's comments around the services that are provided at primary care level, GP, ophthalmology, pharmacy, and one other. Dentistry, very importantly, we hear about that a lot. So that would be great if you can come to that, and that will give you a chance to speak to members of the Integrated Care Board and hear their views in a very similar way. So thank you all for coming. I'm going to draw this to a close, and any further questions, you're welcome to email either Healthwatch Oxfordshire or David to ask, and get a response on that from those people. Thank you very much, everybody. We'll draw it to a close.
Thanks, everybody.
Thank you.